This is going to be a small presentation about some things and some issues we discussed in dental class. And first, I would like to start off with the anatomy of the tooth. First, we're going to start with the enamel. The enamel is like the hardest tissue of the body, and it completely covers the anatomical crown, which means your whole tooth. It's able to withstand crushing forces up to 1,000 pounds per square inch, and it's consistently made of calcium. And it has a translucent color, that means light can sometimes pass through it. Next, we will discuss the cementum. It's a bone-like connective tissue that covers the dental area on the roots and joins the enamel at the CMJ, which is this area down here. Alright. Cementum is yellow in color, but it lacks shine in the translucent of enamel. Next, we will discuss dentin, which makes up the bulk of the tooth. It's found in both the crown and the roots of the root areas of the tooth. It's a hard mineralized tissue. It's harder than bone, but softer than enamel. It's capable of some growth and repair, and is generally yellow in color. Next, we will talk about the pulp, which we all know is the lifeline of the tooth, and is composed of blood, lymph vessels, nerves, connective tissues, and odontoblasts, with the dental forming cells. It's a soft tissue and is red in color, and it's located in the center of your tooth, like I said before, and is divided into two structures: the pulp chamber and the pulp canals. And the gingiva, which is basically your gums, is the soft tissue surrounding your mouth, and it protects the teeth and the underlying tissues. And in life, as you all know, we go through 3 dentition periods. First, we have the primary teeth, which are your baby teeth. You have 20 in the beginning, and until the teeth start to rough, like that takes up to 6 months to 3 years. It helps set up the alignment, the spacing, and the occlusion of your teeth. The next period is mixed dentition, which is the transition from primary to permanent teeth. It occurs when baby teeth and adult teeth are present in the dental arches at the same time. The first permanent molars are present at this time, and the permanent lower incisors replace the lower deciduous incisors. And you can notice color and size difference in the teeth. Next, we have the permanent dentition, which develop around age 2.5 to 6 years old and continue until the growing fully develops into the gums. The jaw grows between the ages of 6 and again around ages 12 to 14. And your permanent molars are fully erupted, which are your third molars or your wisdom teeth. Next, we will discuss some toothbrushing methods. There are 5 different techniques. The bass technique, which is the first, is mostly used by all adults. It's in a circular motion. And next, we have the Stillman technique, then the Chargers technique, then the rolling stroke, and then the Farnes technique is mostly used by children. Some symptoms that we experience with our teeth: gingivitis, which is the inflammation of the gum tissue, but it's easily to treat. Then you have periodontitis, which is an inflammation disease of the gums, including loss of bone and supporting cementum. Plaque, which we all know, is a sticky tooth-colored film on tooth, and is formed by bacteria. Next is calculus. It's basically tartar, which forms near the salivary glands. And it's basically calcium and phosphate salts from the saliva, and that's in the inside bottom of your mouth. Next, I have some recommendations for good oral health. Brush your teeth twice a day for 2 minutes with toothpaste containing fluoride. Clean between the teeth daily with floss. You should use 18 inches of floss, and it should be 1 inch between your thumb and your forefinger when flossing. Eat a balanced meal. Limit your between the meal snacks. Visit a dentist regularly for cleaning and exams, and you should change your toothbrush every 4 months. Now we will discuss the 6 major nutrients, with some on this board right here. First, we have water. Water is the most essential nutrient our body needs to survive. The human body is made up of 90% of water. Water controls body temperature, helps cells and nutrients move throughout the body, and the recommended amount of water is 8 8-ounce glasses daily. Next we have carbohydrates, which are a source of energy for the body, and there are two types: complex, which comes from vegetables and grains, and refined, which comes from fruits, which is fructose, milk, which is lactose, berries, glucose, and beer, which is maltose. The recommended dose is 6 ounces of grains, 16 ounces of fruits, and 24 ounces of vegetables daily. Next we have your fats, which helps to produce energy and also help formation and repair of the brain and nerve tissues. It protects the joints and the organs from injury and provides insulation to the body. Next we have our proteins, which are used for energy and for muscle and tissue construction and repair. They help control water balance in the body, and sources of proteins are soy, meats, and cheese. Next we have vitamins, which assist the body with growth in tissues, and there are two types of vitamins: fat-soluble, which there are 4 major fat-soluble vitamins. Vitamin A, which is for healthy skin, hair, and eyes. Vitamin D is for healthy teeth and bone formation. Vitamin E helps assist fatty acids from oxidizing and great for skin cell regeneration. And vitamin K, which is essential for natural blood clotting and kidney functions. Next we have minerals, which come from the earth crust. We have two types of minerals. Macro minerals are the minerals the body uses in large amounts. There are 7 kinds, which include magnesium, phosphorus, sulfur, sodium, calcium, potassium, and chloride. Next are the micro minerals, which the body uses in small amounts. And those 6 types are selenium, iron, copper, zinc, fluoride, and iodine. And that probably concludes my presentation. So, does anybody have any questions or anything? No? We're good? Okay. So you can cut there.